Hello, and welcome to this webinar hosted by UK and International Health Coaching Association. My name is Ines Kerr, and I'm a director at UKIHCA, and I'll be giving you an overview of what the UKIHCA does before we get into the subject of today's webinar, which is inclusive professionalism, growing grassroots health coaching. And to discuss that subject, we have an expert panel, and I'm just going to ask each of them to introduce themselves before they deliver their own sections. So the UKIHCA, the International Professional Body for Health Coaching, established in 2018. It's a not-for-profit organisation, is self-regulated and relies entirely on income from membership, more of which we'll discuss in a second. So what does self-regulating mean? Well, in the absence of any statutory regulation, UKIHCA has created the standards for education and training, scope of practice, and code of conduct and code of professionalism for the practice of health coaching. But we're not a training provider. So UKIHCA sets the standards and invites the training providers to submit their courses for approval. And when approval is attained, then graduates of those training courses can then apply for full membership of UKIHCA. And currently that's the majority of our members. But again, I will speak more about the different categories of membership that we offer. But what else do we do? Well, our core object is to promote professionalism within the practice of health coaching. So you can see in this diagram here, this illustration, we, besides creating the standards and approving the training courses, we also create CPD for continuous professional development. We host and promote events like this for our members and for the general public, some of which is CPD for members and some of which is about raising awareness for the practice of health coaching. Within the community element, we do a lot to support our members and to add value to their membership, but also to support them in developing and driving forward their businesses. So we have lots of communications via newsletters, members forums. We have coaching practice sessions. We have Connect with Coaches, which is an informal community where members can come together and raise questions and offer support. And we attend a number of conferences and invite our members to come at discounted rates to, again, promote their own professionalism. And besides that, we look also to not create, but to promote meaningful jobs for health coaches. So we work very hard across all sectors to promote the practice of health coaching, the benefits of that practice, in order to raise awareness for the practice of health coaching, but also to create roles and opportunities for our members. So who are our members? Well, as I described briefly, the majority of our members come through a traditional route, which is they would be a graduate of an approved course through a training provider. And they then can apply to become a full UKIHCA full member. And last September, we launched the register for professional health coaches. And the distinction between a full member and a registered member is that a registered member also, besides attaining the standards for education and training, also has to maintain their CPD. And from this year, will also have to evidence a minimum number of coaching sessions, so to prove that they are in practice. And then from next year, we'll be including evidence of supervision. So those are the full members and the registered health coaches. Clearly, we have student members for students in training on those approved courses. But increasingly, we get interest from what we call allied professionals. That is to say, people who may not have completed a complete health coaching course, but have an interest in health coaching. So they could join as an affiliate member. And if they want to take that a step further because they want to practice as a health coach, last year we created the portfolio route to membership. And as it would suggest, professionals with equivalent qualifications, maybe they are practicing health coaching but haven't graduated from an approved course, they can submit a portfolio and we map that against the full standards. And if they meet the standards, then they can apply for UKIHCA full membership or registered health coach status. And most recently, and the something we're going to be discussing more today, is our practitioner membership. So practitioner membership is for individuals who have maybe qualified, they've got a short course in health coaching, and they are practicing health coaching within their current work, but they do not meet the standards for the full approved membership. So practitioner membership is for those individuals who are working as health coaches who want to progress their professionalism, to enjoy the benefits of UKIHCA membership, but most importantly, who are also committed to undergoing a work-based pathway that will be a combination of education, training and practice that will see them attain the full standards so that they can subsequently apply for UKIHCA full membership and registered health coach status. And to discuss more about the practitioner membership, I'll introduce you to my colleague, Faye Hall.
Hello, my name is Faye Hall, and I'm Director for Professional Standards and Membership Development at the UKIHCA. And I'm delighted to be talking to you about inclusive professionalism, growing grassroots health coaching. And what we mean by this is that as the professional body for health coaching in the UK and internationally, we want to ensure access to professionalism and all of the components that go along with that: appropriate CPD, supervision, camaraderie and community within your profession and other colleagues in the profession and stakeholders. We want to ensure career progression and career pathways and clarity over standards for training and education. All these kinds of things which come under the banner of professionalism, we believe are important to be available to and accessible to anyone who has a qualification in health coaching or who is practicing health coaching within an organisation. We believe that there are several routes to becoming a health coach, a professional health coach, and we want to support all routes that are currently active in the industry and in the space, so that we can all join up from the grassroots to advance professionalism and to meet together in alignment in terms of what we believe defines a health coach, the standards of training and education for a health coach, and the scope of practice for a health coach, and indeed employability and the future of the careers of health coaches and the profession of health coaching. So essentially, what is been recently our big piece of work in terms of advancing professionalism and supporting inclusive professionalism is the UKIHCA practitioner membership. So this short presentation is going to talk you through the what, why and how of the UKIHCA practitioner membership in the context of advancing professionalism. So advancing health coaching, we have a vision. Our community of health coaches, our friends, colleagues, and all the people that talk to us and link up with us share one thing in common, and that is passion, a passion for health coaching and a commitment to this new and exciting and evolving, emerging profession. Our vision is that it sticks around, that our jobs are sustainable, that our opportunities for both private practice and employment are long-term and are rewarding. We want careers that flourish. We want access to health coaching for all those who may benefit. Therefore, a happier, healthier population and an engaged, inspired and effective workforce to support them and to deliver. Trust is a really important part of advancing professionalism in health coaching. A foundation of good training standards, of appropriate CPD, recognised supervision, builds trust. When we all agree on a scope of practice and maintain and adhere to that scope of practice in the work we do, when we all engage with access to a register of health coaches and and work towards the professional elements that mean that we can gain access to the register, we are essentially building trust. We're building trust for the public, we're building trust for the reputation of our profession, and we're building trust for employers and people who might engage with our services in organisations and externally in private practice. We're also big on awareness. So we advance health coaching all the time in terms of projects that aim to help organisations, governments, anyone listen to what we're saying in terms of what health coaching is and how it can support a happier, healthier population. So the UKIHCA engages in lobbying, networking, communications. You will notice if you engage with us at all in any of our social media accounts, they're extremely active, and also in our email newsletters, not to be missed. We're constantly talking to employers, the public, and colleagues. We believe in collaboration. So the heart of the practitioner membership is really about learning and growing and sharing together. So building and expanding our community. There's much that can be learnt from practitioner members who might be learning on the job, in a workplace, might come from different backgrounds, different demographics. We also believe in empowerment, self-determination, autonomy, and confidence. In the end, it's probably worth thinking about how we roll as professionals and how we operate in our industry or in our organisations, and what we inspire in others. And a big part of our work as health coaches is self-determination, is autonomy, is enabling others, is empowerment. And we must also look inward and focus on demonstrating those qualities for ourselves in our work. So what essentially I'm arguing is that it's down to us. If we want to make health coaching stick, if we want rewarding lifelong careers in health coaching, then we are going to have to be self-empowered and be confident and make that happen. Solution focus. So whatever's going on in the industry and in our individual lives and our roles, how's your health coaching work going? How's your business going? Whatever hurdles you may be coming across, we believe that we can solve things together, and that we can work together to overcome any issues or problems. And that's what we believe is really important, is this collaborative, solution-focused, empowered approach to advancing health coaching. So a bit more about why UKIHCA practitioner membership. So why is that so important for advancing health coaching and the profession from the grassroots up? Well, it's all about recognising that there are different paths to the same outcome. There are different paths to practice, and there are different routes that people take to becoming a health coach. So one route, which is to complete a full health coach qualification and graduate, and then go out into the workplace or into business, is a popular option. But courses are usually around 9 months to a year long. There can be a cost involved, and they are absolutely worthwhile. And we have, most of our membership is made up of people who will have graduated from a full approved course. And when I say a full course, I'm talking about a health coaching course that has met the UKIHCA standards for education and training, which really set the bar high, and internationally probably are the most well recognised standards for being minimum level 4 qualification, and 600 hours of training with 120 live hours training. So really, really robust preparation for working as a health coach, and completion of such a full approved course results in access to insurance to practice in the private space. But that's not the only story. Many of you, many of us will have become health coaches through different routes. And in 2023, we set up our portfolio route membership, which I came through, which recognised that people have different portfolios of practice and experience in the workplace. That means that they have already met our standards for education and training, but via a portfolio of qualifications and experience. So we give people the opportunity to meet our standards for education and training as individuals through their own unique portfolio of work and qualification. But we were still missing out. We were missing out on a large number of members who we really value and believe will be an asset to our community. And that is health coaches who are in a workplace, employed and trained within their workplace, and maybe have received training that doesn't yet meet standards for education and training as they're set out by professional bodies like ourselves, what we might consider a foundational training, and then are using their experience in the workplace to build effective, safe practice and build on learning, and really, really valuable way to become a health coach. So one could argue, what's the most important experience? Is it lots of robust training and very little casework, or is it a short amount of training and in the supportive environment of an organisation and in an integrated situation with other clinicians supporting your work, and this takes place both in the NHS but also in other organisations, going out and working with a caseload and developing skills as you work. So the UKIHCA Practitioner membership is really recognising that, yes, there are many different paths to meeting the requirements of what we believe is a very, very robust standard of professionalism. That is our register of health coaches and our full approved membership. So who is a practitioner member? Maybe it's you, maybe it's somebody you know. It's someone who has a foundational health coach training. It's someone who is in a workplace, in a role, so supported by their workplace. Often the insurance to practice and the responsibility will be covered in that workplace. So there'll be access to plenty of practice experience. So you'll be delivering health coaching actively in a role. And this person will have the desire to learn more, experience career progression and opportunities to grow in their current role, but also change roles and to have a variety of options for the future. So what is a practitioner membership? What it is exactly in terms of the detail? It's not just a membership category. It's not just a type of professional or individual. It is a whole raft of benefits. And I'd like to just really tease out some of the key benefits of practitioner membership and why we want as many people as possible to be able to access these resources, because it will, we believe, advance professionalism across the board and within the industry. So practitioner members will get a badge of recognition relevant to their category. They will receive free, live, expert-led professional webinars in all of the different areas that the standards for education and training cover, including coaching, including health and wellbeing, including professional practice. There'll be access to a huge library of members-only professional development resources, so plenty of read in your own time and self-directed learning in terms of development resources. Discounts on industry events and discounts on conference tickets, and lots of opportunity to attend conferences and meet up with like-minded health coaches from a number of different backgrounds and contexts, regular newsletters and communications, a Facebook community that's thriving, connect both with other, full members, connect with student members and other practitioner members. So really lots of sharing and learning that can take place there. Access to monthly health coaches networking. So this is something that I really value. Health coaching can be isolating. You're there one-to-one doing your work, and sometimes it's just really important to be able to have not just supervision, but camaraderie. So have someone to talk to. How did your week go? What issues did you come up against? How did you solve them? What are you enjoying? So just really sharing professional experience and supporting each other. So we have access to several networking events that are live opportunities to connect up with Coaches Connect, with professional mentoring, with coaching practice. You can really, the reality of what it's like waking up as a UKIHCA member is you can log on for work at the beginning of the week and you can look at the calendar and there'll generally always be something available for you to attend in a live capacity, whether it's a webinar or a networking event, and be with other professionals and get support. So practitioner membership in terms of specific demographics, as the membership category grows, will come along with communities of practice. So we're looking to set up a community of practice and networking group specifically for practitioner members, for example, who are NHS health and wellbeing coaches. We'll be specifically setting up a community of practice, for example, practitioner members who might come from, for example, the physical activity space, so that each community of practice not only gets the expansive and rich experience of connecting with all different types of health coaches and health coaching stakeholders in the live networking events, but you also have your real niche chance to talk to your community of people working in exactly the same role as you are. And professional mentoring is something that I think is often, not considered as a requirement in the same way that CPD and supervision is, but it's such an asset to have access to mentoring either in a group or one-to-one, where you can really develop yourself, receive some mentoring, some guidance. So that combination of some coaching approaches and coaching skills within a mentoring session, but also the connection and camaraderie, but with a real focus on learning from each other. And that mentoring approach, which is, this is what I've done, this is my experience, this I can share this with you, maybe you can learn from it. It's just so valuable. We get incredible feedback. So here's a quick overview of the practitioner membership benefits. As you can see, just as a quick glance, our full member benefits are just down the left-hand side here, and the practitioner membership benefits are down the right-hand side here. And you can see that actually there is so much value in the practitioner membership when you look at it as a comparison in this document. So what the UK practitioner member is someone who is going to be, as I said, looking for that connection. You will get all of those things as I've mentioned on the previous slide. And it is a distinct membership category because you get access to all of that membership benefit right now. But it is a very unique membership category because it is also aligned with a career progression within your workplace. And so, as you will have heard, one of the requirements for becoming a practitioner member is that you are in a workplace and you are practicing, hence the name, as a health coach. And what we're offering is the opportunity to build on your foundational health coaching training. So through a relationship with what we call a work-based training pathway, every practitioner member, when they sign up with the UKIHCA, will link up with a chosen work-based pathway. And that is a pathway of training that can be taken over a 3-year period in a very staircased and manageable way, which gives you a clear route to achieving full qualification as a health coach, as per our standards for education and training. And at the end of that work-based training pathway, will become possible on completion to enter the Register of Health Coaches and become a full member and access insurance to practice and all of the benefits that come with full membership and registration status. And I will just say that our future strategic plan is to support health coaches even further by taking the step of getting our UKIHCA Register of Health Coaches accredited with the Professional Standards Authority. And we have in our strategic plan the intention to engage with that accreditation process, stage 1, before the end of 2025. So we're really excited about that. If you want to hear more about the register or registration status or accreditation with the PSA, please do contact us at any time. That's potentially a whole other webinar. So how did we come about creating this practitioner membership? How did we decide that it was going to be a good idea? Well, we didn't just make it up. We have been consulting with and speaking to and working with several key industry representatives who have very generously contributed to our NHS practitioner membership steering group. So as a starting point for our practitioner membership, the focus is really on supporting NHS health and wellbeing coaches and engaging with NHS health and wellbeing coaches. So we set up a special steering group made up of these good people, as you can see here on the screen. And we asked them to work with us to develop a membership category that with all the benefits and a strategy for helping practitioner memberships, A, get a membership, get the support they need, but B, also find a way to access staircased training that helps them meet their tiers in terms of the NHS tiers 1 to 3, but also full qualification against our standards and access to insurance and the register. So thank you to all these good people. And we have been listening and contributing and connecting with NHS health and wellbeing coaches for a long time. Many of you listening may already be members or may have met us before. We have been contributing to various groups, steering groups, meeting groups on the invitation of representatives from the NHS. We have been contributing our expertise. We have been connecting for a long time on social media, in meetings, through various mechanisms with NHS health and wellbeing coaches, and listening and learning and understanding what needs to happen in order that the NHS health and wellbeing coach career is maintained. The role is, a very important role. It's NHS are currently the biggest employers of health coaches, probably internationally, and we really want this to stick. We want to be able to help NHS health and wellbeing coaches stay in role, feel comfortable in role, and be able to talk to and navigate their futures, talk to leaders and users of their service in a way that is going to enable more awareness and understanding of what health coaching is and how it can have impact. So I'll just say a little bit more about the link to the work-based pathway, and then I will hand you on to others who will be able to talk in more detail about an example of a pathway and what that looks like. So it's a simple concept that learning and further training can happen alongside and can include practice and experience in the workplace, can and should. And a work-based pathway is a pathway of learning and workplace experience that meets the UKIHCA standards for education and training. So A successful completion of a work-based pathway would lead to full membership and registered health coach status. We have been developing work-based pathways of training through collaborative agreement between the UKIHCA and organisations who are wishing to host and deliver pathways. And we're delighted to be joined here by our colleagues at Peak Health this evening, who are pioneering and piloting the first UKIHCA approved work-based pathway. So they serve both the individual health coach who wants to continue and extend their training and build on what they already know and learn new things and feel safe and competent and effective in the workplace. And they serve organisations who train or employ health coaches to make sure they have employees who are up to date and effective and supported in their practice. So where does a practitioner membership and work-based pathway lead us? Well, it's all about career progression. It's all about moving beyond roles towards establishing a new profession. So the NHS has very effectively established the role of the health and wellbeing coach, and we want to support the future of that role by really ensuring that that develops into a profession for all of those people in role. And we believe we can do that by being united for change and collaborative in our approach. So thank you for listening, and I'm going to pass you on to talk to Peak Health now in a little more detail about what a work-based pathway might look like and the opportunities that are available to you. Thank you so much for listening.
Hi, I'm Caroline Hart. I'm one of the directors at Peak Health Coaching. And in this presentation, I'm going to tell you a little bit about our brand new Peak Health Coaching training pathway for health and wellbeing coaching. So, as you'll see from the diagram here, the pathway is made up of 6 different steps, and I'm going to take you through them one at a time, starting with the very first step of our foundation certificate. So the foundation certificate is a PCI accredited 2-day health and wellbeing coaching course, and we call it Module 1. It's an attendance only programme, and at the end of it you'll get a certificate of achievement without having to undertake any assessment, and it speaks to the levels of the PCI curriculum from levels 1 to 3. If you progress on to the next step on our pathway, this will take you to our intermediate certificate. Now this is a PCI accredited 4-day programme, so if you've already completed the foundation certificate, you'll just need to do the additional 2 days, or what we call Module 2. And at the end of that, again, you will get a certificate of attendance with no requirement for assessment. It will take you into some more depth on the levels of the PCI curriculum. You'll have plenty of opportunity to start beginning to practice your health coaching skills in a safe and supported environment with peers. And we provide lots of ongoing materials to support your thinking outside of the course and beyond the course itself. The next stage on the pathway is our Practitioner 1 certificate. And at this stage, you get an opportunity to have your knowledge and understanding verified. So rather than just turning up on a course and hoping that the knowledge and understanding sinks in, we actually want to support you to know what you have learned and if there are any areas where you would value further support. So we invite you to submit a small portfolio. It's made up of a written assessment, which is very much based on the learning that you will have done in the foundation and the intermediate stages. All of our learning is supported with participant workbooks, and if you've studied with Peak, you'll probably find most of the answers to the written assessment very easy to find. If you're coming from another 4-day course elsewhere, just to know that the written assessment does follow the PCI curriculum, and you are also allowed to discuss your answers with peers. We see it as a formative learning process. We just ask you that when you finally complete that written assessment, it is your own work. We ask you as well to complete some coaching reflections on 3 episodes of coaching practice, as well as asking some of your peers to observe you coaching. That can be live coaching or it could be recorded coaching, and we set you up in action learning sets to facilitate that process. So you submit your portfolio along with a log to show that you've accumulated at least 50 hours of health coaching practice, and we go through a short assessment process, and at the end of that you'll be awarded a certificate of achievement. If there are any areas where we feel you would benefit from further support, we give you that support. We make sure that you do succeed. And for enrolment in 2025, I'm excited to announce that we're including 12 months of the brand new practitioner membership of the UKIHCA. And I'd really encourage you to go along to their website and have a look at all of the benefits that includes. So moving on to the next stage in the pathway, we've got the Practitioner 2 certificate. And at this level, we offer you regular professional development sessions up to twice a month, depending on how fast or slow you want to take your learning. And we cover a wide range of professional development issues in relation to health and wellbeing coaching. We also have flexibility so that we can be responsive to things that you're particularly interested or other peers that are attending those sessions with you. And we will require you to submit a portfolio for assessment at the end of this programme of learning. As you can see from the slide, that includes some recordings of your coaching practice, because at Practitioner 2, we are verifying your competence to practice as well as your knowledge and understanding. Again, there'll be opportunity for you to complete coaching reflections on different episodes of practice, as well as some more detailed case studies where you've worked with clients over a period of time. We work with you to think about how you can gather feedback from clients, as well as, again, asking you to get feedback from your peers to really give you that 360 view of your practice. So there are various different bits and pieces in the portfolio. We take you through it all in detail. Everything is supported with comprehensive online resources and live tutor-led sessions, along with that network of peers that you'll be developing. For 2025, we're delighted to announce that we're also including 12 months of the UKIHCA practitioner membership at no additional fee. So again, something to think about there. Which brings us to the next stage in the pathway. It's very exciting because this is what we think of as a threshold qualification, the Senior Practitioner Diploma in Health and Wellbeing Coaching. The reason why it's a threshold qualification is because at the end of the Senior Practitioner programme, you will have completed 600 hours of learning, and this would be at level 5 equivalent, and therefore it meets and exceeds the UKIHCA requirements for full membership eligibility. So once you've successfully completed our Senior Practitioner Diploma, it means that you would be eligible to join the UKIHCA as a full member. And in fact, again, for enrolment in 2025, we are including 12 months full membership of the UKIHCA for those who are eligible at no additional fee. So this is the time to get cracking, I guess. So this diploma course has an opportunity for you to complete 250 hours of coaching practice as part of those 600 hours that I mentioned. The rest of it is made up of a mix of core and optional modules. The core modules cover professional practice, health literacy, health education, and professional development. Alongside that, you'll be able to choose some options. So in option block A, we have choices around, for example, pain management, metabolic health, mental health, and other areas of kind of thinking about long-term conditions. We'll be adding some more modules as we go forward. And there's also an opportunity to focus in on working with groups, which we know is of interest to a lot of health and wellbeing coaches. In option block B, you can focus on independent practice if that is something that is of importance to you, or you can focus on workplace practice, or you can undertake a negotiated module to give yourself an opportunity to think further about an area of practice that really piques your interest. Then there's a final option block C, where you get a choice between undertaking a research project or a quality improvement project, both of which we fully support you with and teach you various hints and tips and skills to work through. Or if you're interested in training as a supervisor, you could alternatively take the supervisor training module, or indeed a negotiated module to suit your interests. There's lots of tutor-directed learning at diploma level, as well as opportunities to work with peers and to work flexibly independently, and the whole programme is supported with comprehensive online resources. So that takes me to the Master Practitioner Advanced Diploma, which is currently the final step in our pathway, at least for the time being. It builds on the diploma course, again follows a similar pattern of core and optional modules. Our core modules at Master Practitioner level build on all of the 4 core modules that were introduced at the diploma level. And then for the optional modules, you have an opportunity to undertake an extended research project, an extended quality improvement project, or if you didn't undertake supervisor training at diploma level, there's a second opportunity to do that here. If you did complete your supervisor training, there is an opportunity to go on to senior supervisor training. And again, options for negotiated modules to suit your interests. Both the diploma and the Master Practitioner Advanced Diploma involve submitting portfolios to evidence the advanced competencies that you're gaining. And they are both accompanied by those one-to-one supervision style oral assessments as well, which we see as both formative and summative. So helping you to think about your strengths, appreciate where you might want to focus your energy going forward, and to develop a professional development plan for your onward learning journey. So again, both the diploma and the master practitioner would lead to eligibility to meet the UKIHCA full membership requirements. And for this year, we are including a year's membership in all of our course fees. So that brings me to the end of the presentation. So just in summary then, we think that this pathway offers a seamless, modular, flexible route for you to develop your health coaching practice. You can start from scratch if this is brand new to you, or if you've already got some experience behind you, you may be able to step onto the pathway at different stages. And we're really happy to talk to individuals and organisations about that. The pathway is flexible in terms of you moving quickly if you're keen to kind of get on and want to dedicate full-time effort towards your learning, but you can also pause or slow down your journey if you're coupling learning alongside work and other responsibilities. Importantly, you'll become part of a growing national and international network of skilled health coaching practitioners with a strong ethical code of practice and a consistent skill set. So thank you very much for listening, and we're hoping that you'll be joining us soon somewhere on our Peak Health Coaching pathway. For further information, please do go and check out our website, and just popped up the website there, peakhealthcoaching.com. And if you'd like to set up a meeting to speak further about anything that I've spoken about in the presentation today, please do contact us at support@peakhealthcoaching.com. Thanks for listening, and good luck with your health and wellbeing coaching journey.
Hello and welcome to this session. We've been asked by the UKIHCA to come and speak to you today about the benefits and opportunities that practitioner membership offers for NHS health and wellbeing coach. My name is Dr. Caroline Gibson. I am a GP and also a qualified health coach and health coaching supervisor, and I'm really delighted to be here today. And I'm here with my colleague Paul. Paul, would you like to introduce yourself?
Yeah, of course. So my name's Paul Rudd. I'm a health coach team leader in a PCN based in Wakefield, and also a qualified coaching supervisor delivering coaching supervision to health coaches across the North East and Yorkshire.
Super, thank you, Paul. So the purpose of our session today is to explore how the practitioner membership that UKIHCA is introducing can support NHS health and wellbeing coaches, and how it can help address some of the challenges that we know health coaches are facing in the NHS, and how it can offer some new and exciting opportunities. So before we start, I'm just going to ask you, Paul, what excites you about being a health and wellbeing coach in the NHS?
I think it's stuff that we'll probably talk about later on, but it's the opportunity to help people, and that, all of us as health coaches, we get that kick, that buzz out of supporting people, support themselves, and seeing those magic epiphany moments land with them. And really it's really that forward thinking, that shift that I hope to see longer term in healthcare, where we just look at supporting each other. You know, the whole thing of finding your tribe. It's easier to run a marathon in a group. All those types of phrases and metaphors that I use as a coach to others. That's kind of what excites me, that shift to more supporting each other, just be well.
That's really super. So that's a really lovely image and metaphor for where we're going. But let me start by taking a step back to where we have come from with health coaching in the NHS. So health coaches, from an NHS point of view, although there have been health coaches in the NHS for for many years, it's been very, very small scale and only in very isolated pockets until 2020. So NHS health and wellbeing coaches were introduced at scale into primary care as part of the ARS, which is the Additional Roles and Responsibilities Scheme, which was a government funded initiative in 2020 to provide funding for these additional roles. And in 2020, health coaches were introduced to be one of those roles that could be funded at PCN level for GP to work in GP practices. And this is all part of the NHS long-term plan, which is really centred around providing more personalised care, person-centred care, with a real focus on looking after individuals and what matters to them. So there were several roles introduced to help support personalised care provision. So that was social prescribing link workers, care coordinators, and health coaches. And we're obviously here to focus on health coaches, but it is useful to understand that wider picture of the system that they work in. And health coaches are employed in primary care as a non-clinical role to work as part of the MDT, the multidisciplinary team in primary care, to support individual patients to be able to implement behaviour changes and increase their knowledge, their skills, their ability to self-manage their health conditions in line with what is important to that person, what matters to them. So when this was first introduced in 2020, it was a very difficult time to introduce this role, but it was set up with lots of support in mind to help embed this new role, to help introduce them to the system. So alongside introducing the role, health coaches were based in PCNs, but had support from regional teams and national teams. There was a whole system of mentorship with regional level mentors. That's where I got involved personally in working with health coaches in the NHS. I worked as a mentor for health coaches in the northeastern Yorkshire region, and so health coaches could access their regional mentor for support and guidance, and just as a point of contact and part of their sort of local regional networks. There were also regional share and learn sessions and national share and learn sessions and CPD and webinars to help support people coming into this new role. There was also online platform on NHS Futures, and over time there was development of the health and wellbeing workforce development framework, which was developed and then published in 2023. So the role was set up with really big aims to have a massive impact across the whole of the system. And so that was how it started. Paul, would you like to tell us a little bit about how it is now?
Yeah, so I mean, even from those first two slides, it was kind of that momentum was being built within the system of the NHS for health coaching, and that appetite has always been there for supported self-management, but employing coaches now nationally is that vehicle to really push and drive that narrative forward. But where are we now then? So sadly, there was the funding streams has changed, so we no longer have the regional mentors, the roles in place. So with that as well, there's no more share and learn sessions. There are obviously webinars that are happening that people can access, but it isn't solely for health coaches, let's say, it's ad hoc. You can find CPD where you can. So we don't have that structure of the tribe coming together, the coaching community coming together within the NHS. It's not structured anymore. Because of that, obviously, there could be a lack of learning and development opportunities for coaches, and it's very much system dependent or regional dependent now with the funding as it is. With that supervision, it is stated that health coaches should receive coaching supervision along with the other modalities of supervision. But who's going to be paying for this supervision? It's very much dependent on the region that you're in. So what we're finding now is there might be pockets around the UK where you've got coaches who are being supervised and maybe coaches who aren't being supervised. And what we do know from that is there could be a big varying in confidence in working with people with more complex long-term health conditions or mental health needs. And what we really want is a supervised workforce to really help promote and grow the role. And since the development of the workforce development framework, there's not really been much further guidance nor sort of enforcing that as well. I think that it has set up with some brilliant support for employers to support the health coaches in the role, but there is little support for the employers to enforce that framework. So what it kind of feels like is we've been building up a lot of this momentum for coaching within the NHS, but we might just be slowing down a bit. Like Caroline said, those support structures were in place at the beginning. As soon as you remove the support structure, it could start to drop a bit. And that's maybe what is happening, or we might be at the beginning of that now. So we've put in there, we obviously love a metaphor, a train losing steam. So it's kind of where it feels like we're going. But then what can we do about it?
Yeah. And I think that's a lovely metaphor. And at a wider system level, we have seen that the changes to the structure of the NHS, reorganisations, changes and reductions in funding, loss of the personalised care team, devolution out to ICBs has resulted in this marked variability across the system and reduction in support supervision. So that's kind of what's happening at a system level. But then that has that impacts down and filters to a PCN level and also for individual coaches. And I'd like to just spend a bit of time now thinking about the impact of this lack of support and this variability across the system on our individual coaches. So Paul and I both work as coaching supervisors, and I'm fortunate enough that we are in an area of the country that has provided some funding for coaching supervision, and I lead the supervision programme across the North East North Cumbria ICB. And what we hear every day from coaches who come to supervision really fall into just a few broad themes. We hear from coaches every day that they are working in a system that doesn't understand what they do properly. They, despite being in the role existing for 5 years, the system hasn't quite got used to them yet. Doesn't understand what a health coach is for, what they can do, but also what they can't do. And we hear time and time again about coaches being asked to do things that are outside their scope of practice, that the role wasn't intended for, but the PCNs would like them to do. And despite there being a workforce development framework, how that actually is applied and used is very variable, and most coaches find that once they're in role, there isn't a natural next step to progress to develop their careers further. So that lack of development opportunities is something else that we hear. Many coaches work in very small teams where there may be just one health coach on their own, or just a couple of health coaches within a PCN. Or even if there is a larger team, the health coach is often scattered across different practices within that primary care network. And the result of that is coaches feel very isolated. So they're having to work in a role that is not very clear, that they haven't got many opportunities, but they're battling on their own for that, to be able to deal with that situation. On top of that, this is in the NHS, we know that it's a really challenging environment at the moment, and healthcare is getting more and more complex. We have an aging population with an increasing burden of chronic disease, and people are living longer but less healthy lives. The health span is reducing, and we are seeing people develop chronic conditions earlier and with multiple different conditions affecting the same person. So the people that people are working with are very, very complex. And being able to manage this as a health coach about what is appropriate for coaching, what needs other other support from the multidisciplinary team, is not always clear. And health coaches are finding that what is expected of them is often outside scope of practice. So these system problems are filtering down, and we're seeing this on the ground with our health coaches. So the themes are that the need for professional development, for networking, and to address some of these challenges of lack of recognition, lack of credibility of the role, and problems with integrating into the team. So, Paul, what would you like to see as a health coach to address some of these issues?
Yeah, of course. And this is kind of the themes as well of what the coaches attending our supervision sessions tell us that they want as well. This is kind of across the board. And I think the first two there, the confidence and competence, is kind of a thing that I talk a lot about with my team basically, and support them in my PCN. But that's kind of what the coaches are wanting. They want to feel more confident in their role, particularly dealing with that aging population and with more complex health issues. They want to be competent in working with this population and with the coachees and patients that they're working with. They want to feel and know that they're on the right path, and sort of know that they're developing their skills in the right way. Retention is a big one as well. Since I've started in this role, I've known many health coaches start and leave and find different roles now, which is incredibly sad, because we do lose some tremendous people who have a real appetite for helping others, and that's kind of the whole value of the role, isn't it? So what they do want is to have that security within the role, and we want that job retention. And really important, and personally as well for myself, progression. We want a career progression. We want to make sure that coaching's here to stay, but also evolve and grow and develop into something further that can provide further benefit to people. Like, we do know that like Caroline said, we're getting increased aging population, and we might need more. We need more of a workforce to deal with that. And, I see health coaching as being one part of the solution towards that. So progression is something definitely that we hear quite a lot, about coaches wanting to develop their careers.
Yeah, absolutely. And so I'm really delighted to be part of the UKIHCA steering group that has helped shape the new practitioner membership, because I think that it's going to offer to meet so many of those needs that are out there for coaches. So what are some of the benefits and opportunities that are part of practitioner membership? So starting firstly with coaches, we've got practitioner membership offers an opportunity for individual coaches to experience and to have some of that professional development that they need to be able to grow and develop, and of their skills, their knowledge, their competencies as coaches. Practically, that looks like webinars. It looks like access to evidence-based resources, CPD sessions, support from more experienced coaches, and all of those things that will help somebody develop professionally in whichever way they want to take their health coaching career, working towards full membership of UKIHCA and becoming a fully registered health coach. Secondly, it is a wonderful network of similar like-minded coaches who are doing similar things, working in the same area, but also across other sectors. And we know from our supervision sessions that when you meet people who are working in different areas, you can get new ideas, you can share experience, you can share best practice and learn through other people's experiences. So that opportunity for networking and community to come together, and not just for learning, but also just support, because we know a problem shared is a problem halved. And when we are seeing patients one-to-one, we don't get the chance often to sit down and to reflect on it. So having a community of people who understand the work that you're doing is just so powerful in that support. Next, there is something about quality. So that bit that we know, so how do we know that we're doing a good job? And being part of practitioner membership provides you with a pathway to developing your skills to full membership. And part of that is being able to practice to a good quality, high quality, following best practice, evidence-based standards. And being able to evidence that you can provide good quality evidence-based standards then provides you with that professional recognition and credibility and clarity about what you can do. And so all of that comes with practitioner membership. So I focus very much on the benefits for coaches there, but we must remember that we are working in service of our patients, of our coachees, and that there are benefits to them too as well. So Paul, do you want to talk about this from a point of view of coachees?
Of course, and part of that steering group, obviously the key thing there was looking about who are the key stakeholders, and a really good thing and important thing to note was it's always down, to keep the patients and the coachees at the center of all of what we talked about. So what would be the benefits to the patients or coachees with the practitioner membership? Well, they get to access coaches who would have a higher basically quality coaching skills and knowledge. As part of the membership, you'd be able to get access to more CPD and professional supervision. And as part of being a coach, reflecting on your practice is a really good skill to look at developing further as well, to just help improve your coaching practice when you've got that person in front of you. So the patients that you'd be working with would effectively have a higher quality coach to work with. What we do know as well, as part of that, it does meet with the professional code of conduct and your professional standards with the UKIHCA. So that's also going to be a really big win for patients that you work with. And alongside that, they will therefore have a greater confidence and trust with you as that practitioner that they're working with, or that coach that you're working with. And what we do know, which really consistently across the research with any behavior change intervention, is it's the rapport that you have with the person who is leading or facilitating that intervention is a really key variable, and that really important variable to improve the outcomes that they see. So having a greater confidence and trust in the coach from the patient's perspective will be really imperative of getting further health outcomes. And as we've talked a little bit about where coaches fit within a multidisciplinary team, being part of this membership and obviously being more supported within the role, you'll probably gain more confidence to have more conversations with the wider MDT. And with that, you might get better referrals. You might be able to standardize the boundaries further within your role. So for the patients and the coaches that you'll be working with in your practice or PCN, you should be able to get that improved continuity of care as well, and just helping you integrate within that practice better.
Yeah. And that leads me on nicely into thinking, because we about the wider system that we're working in when we're thinking about the networks and the teams that coaches work in. We started off talking about the benefits for coaches. We thought a bit about the benefits for individual patients or coachees, but also there are the wider system does benefit from having a practitioner membership scheme and coaches being part of that. Well, the benefits for the wider system is that there will become a better understanding for for people who aren't coaches, for the managers, for the system leaders, will be able to see that there is a standardization of practice with consistency and quality training for coaches who are part of that practitioner membership, and that will have a knock-on effect of being able to implement health coaching more widely across the system. Coaches who are happier in their jobs, who've got progression, are more likely to stay in the workforce and less likely to leave. So reduced staff turnover, increased retention will be an absolute benefit for the system, because at a system level, that means that costs are less, because training new coaches to replace ones that are leaving is absolutely not a good use of resource when we could be keeping and retaining the ones that we've got. And Paul's already touched on that, this having better trained coaches who are more competent in their skills will be able to work more efficiently, more effectively with their patients, which ultimately leads to better health outcomes. We know that better health outcomes leads to reduced costs across the system, both from healthcare costs, but wider society costs as well. So all of these things will be benefits to the wider system from practitioner membership. Now, over the last 20 minutes or so, we've given you a lot of information there and shared a lot of thoughts. So I'm wondering if I could offer you the challenge, Paul, of summarising all of that for us.
Yeah, challenge accepted. I mean, if you're watching this, basically you're invested in health coaching. You potentially would see the benefit if you're not a health coach or maybe a system leader or a commissioner. But it's just to really summarize and acknowledge the importance that health coaches are doing across the UK, and we do have a really important role. And I think also a responsibility to just be passionate and look at growing and developing it. In terms of summarising the benefits and opportunities that the practitioner membership can offer, it does scream support and development and sharing best practice. I absolutely love personally getting in a room with like-minded people and maybe different-minded people and bouncing good ideas around and sharing best practice. I really do feel like that's where you can generate new ideas. And I think the opportunities that this could present people with is exactly that, to find your tribe, to have access to better CPD and learning opportunities. And obviously, as part of that, you get to develop your coaching practice. In summary, it should help you develop that further, meaning that you're more effective in your coaching role. And leading, therefore, like Caroline mentioned previously, to better outcomes, better health outcomes for the patients and coachees that you're working for. And also, I guess the knock-on effect from that as well is, with more reporting of better health outcomes and cost savings and all this amazing work that might be going on in the background, there could be that development for career progression as well. And I know as part of the membership, it's not just within healthcare, there's other sectors where health coaching is making moves. So I think it can also help develop that appetite for exploring within and across wider sectors as well.
Yeah, so I think in summary, it's lovely to hear that combination of supporting coaches in the role that they are working in. It's about helping coaches develop professionally to meet their potential as coaches, and also supporting coaching quality across the system as well. So and I think that all of those things together will help practitioner membership strengthen the coaching profession, and therefore then have a lasting impact on healthcare. So I'm going to draw us to a close there. I'd like to offer you appreciation and say thank you for listening to us. We are both incredibly enthusiastic about health coaching, and we'll talk endlessly if you give us the opportunity about health coaching. So if you'd like to hear more from us, please do get in touch and we'd be happy to discuss this further. Our contact details are there on screen, or get in touch with the UKIHCA team and we would be delighted to connect with you. So thank you very much from me, and thank you, Paul, for your time today.
No, thank you very much.